All right, so leukemia is going to be under the white blood cell issues. Okay. In acute leukemia, what we're dealing with is we're dealing with cancerous white blood cell precursors called blasts. They're going to proliferate into the bone marrow or lymph tissue and then accumulate in the peripheral blood, the bone marrow, and the body. Untreated acute leukemia invariably is going to lead to death, usually from complications of leukemic cell infiltration of the bone marrow or the vital organs. Acute leukemia, it is ranked as pretty high cause of cancer-related deaths among people of all ages. With treatment, prognosis is going to vary. And if you're dealing with pediatrics, for example, among children, acute leukemia is the most common type of cancer that you're going to encounter. So we talk about leukemia a lot in pediatrics, but keep in mind, we do deal with it in the adult population too. So what happens here is, the pathogenesis of acute leukemia, it's still not completely understood. What we do know is that the immature, non-functioning white blood cells appear to accumulate first in the tissues where they originate, so your lymphocytes in the lymph tissue and your granulocytes in the bone marrow. And these immature white blood cells then spill into the bloodstream and infiltrate other tissues. And eventually they cause organ malfunction, or potentially even in hemorrhage. So what you need to understand, like, we know that white blood cells are responsible for fighting off infection, but you have in leukemia an increase in immature white blood cells, and immature white blood cells are unable to fight an infection. So that's what causes the problem here, is you have these baby white blood cells that are basically ineffective, that are crowding out all of your other cells that you need. So risk factors of this, it can be caused by a combination of viruses. It could be genetic and immunologic factors. It could be secondary to radiation and certain chemicals, specifically radiation and chemotherapy. And we've seen this a lot where an individual will get cancer, they will get radiation and chemotherapy, and they'll beat their cancer, and then a decade later, they will have leukemia secondary to the chemotherapy that they reserved or that they received. So types of leukemia, there are 4 different types. You have, they're all either going to be acute or chronic, and then whether we're dealing with a lymphocytic or a myelogenic type of leukemia. So ALL, that is marked by an abnormal growth of lymphocyte precursors or lymphoblasts. That is what you see with pediatric leukemia. ALL is like the pediatric leukemia. You also have AML, which is characterized by rapid accumulation of myelocyte or myeloid precursors, or your myeloblasts. You can have the chronic lymphocytic leukemia, and then you can have chronic myelogenic leukemia. Okay. In terms of prognosis, the 5-year relative survival rate for leukemia is over 50%. And the survival rate is going to depend on the type of leukemia, the age of diagnosis, the gender, and the race a lot of times. So signs and symptoms. So usually they have pretty non-specific symptoms. So you're going to see fever, infection, you may see abnormal bleeding, easy bruising, petechia, fatigue, weight loss, bone pain, enlarged lymph nodes. You're also going to have some non-specific symptoms like low-grade fever, pallor, and weakness that can persist for months before some of the other signs and symptoms will arise. As the disease progresses, the patient may develop dyspnea, fatigue, malaise, tachycardia, palpitations, abdominal and bone pain. So it just kind of depends on as metastasis is happening, and as those immature white cells start crowding out all the other things, that's when you're going to start seeing those other symptoms. And as they infiltrate the organs, that's when you're going to start seeing like abdominal pain, like enlarged livers, enlarged spleen as well. So diagnosis for this, the bone marrow biopsy is going to be performed in a patient with the typical clinical findings. Excuse me. The bone marrow aspiration is going to show proliferation of the immature white cells, and that's what's going to confirm your diagnosis. Okay, anytime we're diagnosing cancer, you got to go to a bone marrow aspiration or a bone marrow some kind of biopsy. Okay. The WBC differential, that will differentiate the cell type, so that's what your CBC is for. Your CBC will also show decreased levels of hemoglobin, platelets, and your neutrophils. Lumbar puncture would be useful to detect meningeal involvement. And so genetic analysis, the CML has something called a Philadelphia chromosome. So you would do a genetic analysis if you suspected that type of leukemia. So how it's treated, systemic chemotherapy is going to be used to eradicate the leukemic cells and induce remission. It's going to restore normal bone marrow function. And the chemotherapy is going to vary with specific types of leukemia. I don't want to go into all the different treatment regimens. I suspect you guys will probably cover that in pharmacology, but just know that we use a lot of different medications depending on what we're dealing with. And a lot of times they're going to use a cocktail of chemotherapy because it's got to attack, this rapidly dividing cancer. So they'll use a combination of chemotherapy and radiation therapy to combat whatever we're dealing with. Other treatments you might see utilized will be antibiotics, antifungals, antivirals. You may be giving red blood cell transfusions. And for some patients, a bone marrow transplantation is an option. We now have found that peripheral blood stem cell transplants are being used widely with success. So with your leukemias, with your lymphomas, blood stem cell transplants are kind of the new thing that we're doing to combat leukemia and your lymphomas, but they are not without risk, okay? Anytime you're dealing with a transplant, either of the bone marrow or the stem cells, the patient has a very risky period afterwards in which they basically can't even leave the hospital because of risk of rejection and or high risk for infection. So a couple other things, let's talk about nursing diagnoses here. This patient's, high risk for injury, especially infection and bleeding. So we want to control infection by placing the patient in a private room and imposing reverse isolation if necessary. You want to coordinate care so the patient doesn't come in contact with staff members who also care for patients with infection and infectious diseases. You want to avoid using any indwelling catheters. We don't want to give IM injections. We also want to make sure that we are screening our staff members and visitors for any contagious diseases and report any signs and symptoms of infection. We're going to watch this patient's vital signs very, very closely, usually at least every 2 to 4 hours, and we're going to report any temperature over, 100.4. That's also accompanied by a decreased white blood cell count. We're going to watch this patient for bleeding. So we're going to avoid giving any aspirin-containing drugs. We're going to avoid taking rectal temperatures. We're going to watch for any kind of ulcers in their mouth. We're going to check for any ulcers and gum swelling. We're going to provide frequent mouth care, saline rinses. You want to minimize stress by providing a calm, quiet atmosphere that promotes rest and relaxation. You want to provide psychological support by establishing a trusting relationship with the patient and allowing this patient and the family to express their anger, their anxiety, and their depression. Encourage them to participate in patient care as much as possible. And we want to refer the patient to any groups like the Leukemia Society of America. For a patient with terminal disease that is resistant to chemotherapy, then we're looking at supportive care directed at promoting comfort, managing pain, fever, and bleeding, and offering emotional support. And you want to provide an opportunity for spiritual counseling if appropriate, and discuss the option of home or hospice care. Okay, so while leukemia has a wide range of prognosis, we need to prepare the family for all different types, whether we're dealing with hospice care or if we're dealing with a patient that goes into remission. either way, we need to make sure that we are giving the family everything that they need in support. All right, and that is going to wrap up leukemia.